All right, so I know it's Christmas Eve, and you're probably thinking about, well, pretty much anything BUTIVs.
Yeah, probably not top of mind for most folks right now.
Exactly. But trust me, this deep dive is packed with info that's actually useful for everyone, even if you've never had an IV in your life.
It's like you don't need to be a chef to appreciate a good meal. You can still enjoy it, right?
Totally. It's about understanding how our bodies react to things and what can go wrong, even with seemingly simple medical procedures.
Because the truth is, IV therapy is incredibly common, but most people just focus on the benefits, not the potential complications.
Exactly. And that's where this deep dive comes in. We're going to empower you with the knowledge to recognize warning signs and be a better advocate for your own health.
Absolutely. We want you to walk away from this feeling informed and prepared no matter what.
Right. And to help us navigate all this, we've got this awesome visual cheat sheet of common IV complications. Don't worry, you don't need a medical degree to understand it. We're going to break it down together, step by step. You'll be surprised how much you remember just from this quick deep dive.
Yeah, it's all about making this stuff accessible and relatable because it really does apply to everyone.
Okay, so first up on the list, air embolism. Okay, now that sounds kind of scary. What exactly is that?
So picture this, tiny air bubbles, right? They sneak into your bloodstream through the IV tubing, and your body, well, it sees these bubbles as like these foreign invaders.
Oh no, like little troublemakers.
Exactly. And your immune system freaks out, basically. It goes into overdrive trying to fight them off,
Yeah.
which can actually lead to blockages in your blood
Oh
vessels.
wow, I see. So it's not just the bubbles themselves, it's how our body reacts to them, right?
Exactly. It's like a chain reaction.
Okay, that makes sense. But how common is this really? Should I be, like, legitimately worried about air bubbles in my IV?
So it's definitely rarer than some other complications, but it can be really, really serious.
Serious.
Because those bubbles can block blood flow to vital organs, like your
Hmm.
heart and brain. And when that happens, every second counts. You need medical intervention fast.
That makes sense. On the visual, it mentions symptoms like a rapid heartbeat and chest pain, even like a bluish tinge to the skin. It all sounds pretty intense.
Yeah, that bluish tinge is called cyanosis. It's basically because your blood isn't carrying enough oxygen.
I see. So like when you hold your breath for too long, you kind of turn a little blue.
Yeah, exactly. It's the same idea. And that rapid heartbeat, that's your body's way of trying to compensate for the lack of oxygen.
Wow, okay, that makes sense. Okay, moving on to the next one. Infiltration. I think I've actually experienced this. It's that like uncomfortable bump you get when the IV needle misses the vein, right?
Oh, you got it. That's a classic infiltration example. It's basically like poking a hole in a water balloon. Instead of going into your bloodstream, the IV fluid leaks into the surrounding tissues.
Oh, I see. It goes where it's not supposed to.
Exactly, and that causes swelling and pain. Not a good time.
Yeah, no kidding. I remember that feeling.
Yeah,
Not fun. And I bet it messes up the whole treatment plan too, right? If the fluids aren't going where they're supposed to.
you're absolutely right. It delays medication and can be super frustrating for everyone involved. It's a good reminder that even routine procedures, they can have their quirks.
Yeah, that's true.
Yeah.
Okay, so the next complication listed is infection. Now, that one seems pretty self-explanatory, right?
It does, but it's super important to be aware of. Anytime you have a break in your skin, there's a risk of bacteria getting in, right?
Yeah, makes sense.
And with an IV, that catheter goes directly into your bloodstream.
Oh, right, straight to the source.
Exactly. So those infections can spread like wildfire and become really serious really fast.
Okay, so what should we be looking out for? What are the, like, red flags?
Well, the usual suspects: fever, chills, redness, and swelling at the IV site. But you also want to watch out for even subtle changes, like increased pain or warmth around the area.
Okay, so basically any change from the norm, really.
Right. It's always better to be safe than sorry and speak up if anything seems off, even a little bit.
Yeah, totally. Early detection is key, right?
Mhm.
Okay, the next one on our list is circulatory overload.
This is when you get too much fluid too fast.
Right, like drinking from a fire hose.
Kinda, yeah. Now, this is interesting. The visual says a cough can be a sign of this.
A cough. Wait, that seems kind of strange. How are those connected?
Okay, think of it this way. If you drink gallons of water all at once, you'd feel super bloated and probably have trouble breathing, right?
Yeah, I could see that.
It's kind of similar with circulatory overload. That excess fluid in your bloodstream backs up into your lungs,
Oh, wow.
and that causes that cough and shortness of breath.
So it's like your body is drowning from the inside out.
Yeah, That's a good way to put it. It's your body trying to get rid of that excess fluid any way it can.
Wow. Okay, that's a powerful image. All right, next up we've got phlebitis, which, if I remember correctly, is basically inflammation of the vein.
You got it. Now, remember how we talked about infiltration, where the fluid goes where it shouldn't?
Yeah.
Well, phlebitis is like the vein itself is getting irritated.
Oh, okay. So it's like a direct insult to the vein.
Exactly. It's like, when you sit still on a long plane flight and sometimes your legs swell up?
Oh, yeah, for sure.
It's kind of a similar concept here. The catheter itself, or even the medication being infused, it can irritate the vein.
Yeah.
And that causes redness, tenderness, and this like cord-like feeling along the vein.
Ooh, yeah, I can imagine that wouldn't feel too good.
Not at all. And last but not least on our list, we have hematoma.
Which in plain English is basically a bruise, right?
Right. It's a collection of blood in the tissues. It often happens when the needle punctures the vein, or if the IV site isn't properly compressed after they remove the catheter.
Okay, so like a little internal bleeding situation.
Basically.
Gotcha. So after going through all of this, it seems like the main takeaway is be observant, ask questions, and don't hesitate to speak up if something doesn't feel right.
You hit the nail on the head. Knowledge is power, and knowing about these complications can make you a much more active participant in your own care.
I have to admit, this deep dive has been eye-opening, even for me. I'm definitely going to be more aware and ask a lot more questions next time I need an IV.
That's what we want to hear. And remember, we've only just scratched the surface here. There's so much more to learn about IV therapy and all its intricacies.
It's amazing how much complexity there is in something we often take for granted.
Right. And that's why we do these deep dives. Because knowledge is empowering.
Absolutely. Now, for all our listeners out there, what are your thoughts on all of this? Have you ever experienced any of these IV complications? We'd love to hear your stories and thoughts. Share them with us. And be sure to join us next time when we'll dive into the fascinating history of IV therapy and how it all evolved over time. It's a story you won't want to miss.
We'll see you then. Happy holidays, everyone.
Happy holidays.
Happy